Hello, I'm Dr. Kelly Brown, and I would like to welcome you to DDS, Disclosing Dental Secrets Expose, here on webtalkradio.net. Imagine being a fly on the wall at a dental convention. What are dentists talking about behind your back? DDS Expose is not your plain vanilla how to brush your teeth program. It is a controversial look behind the professional curtain of dentistry, and like Star Trek, we will boldly go where no one has gone before. Today, to join us on this adventure, we will have the opportunity to pick the mind of renowned dental expert Dr. Brandon Jones. We will be exploring his newly released white paper, Straight Talk About Crooked Teeth, which is an inside look at a controversial new technique that reduces tooth straightening from 2 years to only a few months, and why some dentists won't offer you this option. Dr. Jones provides state-of-the-art dentistry in his practice. He has postdoctoral studies in implants, orthodontics, cosmetic and reconstructive, and sedation dentistry in his laid-back, down-home rural practice located in Newcastle, Oklahoma. Although Dr. Jones' practice is not in a high-profile community, patients seek him out from many states, and he is known by his peers as one of the industry leaders. And at the end of this interview, it will be obvious to you why this is happening. As your DDS Expose tour guide, it gives me great pleasure to spend the next few minutes with Dr. Jones and you exploring his latest provocative report, Straight Talk About Crooked Teeth. Good morning, Dr. Jones.
Good morning, Kelly.
I know you've got a busy schedule today, and I sure wanted to thank you for taking time out of your busy schedule to share with us here on Web Talk Radio to talk about your latest paper. But before we get started on this, Dr. Jones, and this is a personal question. I hope you don't mind me asking this, but it's my understanding that you've had a long and winding road into the dental profession. Is that correct?
Well, yeah, that kind of is correct. After graduation, my career kind of took different turns. I tried out some different professions, but I always kind of had dentistry in my heart growing up. And so I decided that is what I wanted to do and I wanted to become. And it's been real nice because a lot of the other careers that I had prior to becoming a dentist have allowed me to relate a lot with my patients and share experiences with them, and we can laugh and cut up, but we can also be serious and connect. And it's been a good blend, a good variety to have in my profession, in my career, in my office.
So basically what you're saying here, Dr. Jones, is that because of your background in the real world, outside the world of dentistry, you kind of understand a little bit more about how your patients are thinking or whatever, maybe than somebody that just plowed right on through and went through college and dental school and jumped right into a dental office.
Well, we try. We very much try to identify with people and where they come from and their different walks of life. And when you have more than just one walk of life, it allows us to do that, and we appreciate the opportunity the patients give us to do that.
Well, that sounds like it makes a lot of sense to me. Sounds like it's a great environment over there. So let's before we tackle Straight Talk About Crooked Teeth, I want to alert our listeners to something. I want them to know that if they have any questions about this or any other dental topic, Dr. Jones has been willing to share his contact information with us at the end of this interview. He's also promised us, as this is kind of a unique and special thing he's gone out on a limb for, he's also offered for anyone who's interested on how they can receive a special gift worth several $100s after this talk. He's going to be giving them the information on how to get that done too. So for you listeners, be sure and stay tuned to the end of this interview. So Dr. Jones, let's dive into the topic of straight talk about crooked teeth. I grew up and, there were kids that had crooked teeth. I have some crooked teeth here, there, and wherever. And so, what's the big deal about crooked teeth? Why should folks be concerned about it if they have it or they know someone who does?
Well, the simple answer is there's many reasons. When it comes to crooked teeth, I approach it a lot the way I approach other aspects of the teeth in my office. First of all, we want to make sure there's no pain. Second, we want to make sure that things function right and they're balanced so that they don't break on us. And then 3, we work on the pretty. And we try to get them to where people like the appearance of their teeth. As it relates to crooked teeth, it just kind of brings to mind some stories I was hearing from a colleague of mine at our last meeting. He shared with me one of his patients had noticed that she had crooked teeth growing up, but she didn't take action upon it to do anything about it per se. Well, before long, she has a relationship and she's dating a gentleman, and she's kind of thinking that this may be a serious relationship and may move forward into something more serious, marriage, whatnot. However, what she was unaware of was that her crooked teeth were allowing bacteria to kind of set up between her teeth. She couldn't keep them as clean as she would like, so it led to gum disease. And when you have gum disease, with the buildup of bacteria, breakdown of tissue, it can also lead to halitosis or bad breath. And unfortunately for this young lady, down the road, her loved one finally broke it to her that he was having a hard time tipping her because of her bad breath. And boy, that can take a toll on someone's self-confidence, and consequently the relationship ended. So that's an unfortunate avenue where crooked teeth effectively could have cost this lady a relationship and a happy marriage down the road.
Wow. Yeah.
Yeah. And so another gentleman that we knew, he also had crooked teeth, salesman, and he had been successful in the past, but something he'd always wanted to do was outside sales. He had been an inside salesperson and done well at it, but he was self-conscious about his teeth. And Kelly, the thing is when people have an issue with their teeth or their appearance, many times on the outside looking into that person, you look at them and you don't see it, but it's huge to them. And it can affect how they perceive themselves in their world and around their circle of influence of people. So this gentleman, he did not quite have the drive outside the office that maybe he had on the phone. So consequently, as an adult, he came and got his teeth straightened, had a greater heightened sense of self-awareness, self-confidence, and went out and got himself that outside sales job and nearly doubled his income.
Wow.
So there's a couple different ways right there of issues where people should be conscious of having crooked teeth, things that they can do to improve upon their situation, and it's not just something for teenagers.
So it could be, what you're saying here is crooked teeth could cause you to lose love and money.
That's true. We've seen it.
Oh, my gosh. Okay, now we're talking some serious stuff here, Dr. Jones. Okay, so have anything else, any other thoughts on why people should think about straightening their teeth?
Well, just if they, if like I said, self-confidence is a good way to do it, or a good reason to do it, outward appearance, because, you're only as good as beautiful on the outside as you feel like you are on the inside.
There we go.
And on top of that, one thing we do want to make sure is that they keep these teeth for the rest of their life, because if they do compromise the function of them, the balance and the forces that happen with their bite, they could end up breaking their teeth, which, you know, we love doing dentistry, but we love it when we don't have to do dentistry and people can keep their teeth for the rest of their lives.
Yeah. Okay. That sounds like a great deal. So it sounds like to me, I'm sold on this. We need to have some straight teeth. So let's talk about how in the past, you know, what our options are as patients. If we had crooked teeth in the past, and we go to, you know, we go in and we want to get our teeth straight, what could they do for us at that time, Dr. Jones?
Okay, well, something that has been done in the past is a lot of times people will go in and get, say, cosmetic crowns, to where you go in and you remove some of the tooth enamel and then you replace it with a crown. Now, there's scenarios in dentistry where we do that every day, and it is recommended. However, if we're talking about some moving of teeth or straightening of teeth, sometimes we may have to take quite a bit of that natural enamel away from the tooth, and then we replace it with a crown, but maybe the forces are not distributed quite down the tooth the way we want it to be, but it does give the appearance of straighter teeth. But that's kind of cutting your nose off to spite your face. Minor changes being done with a major procedure.
Yeah, so when you go that route, you're pretty well committed. There's no, you know, reversing it or whatever, because you've pretty much eliminated you know, the natural thing and put on the cosmetic crown or whatever. Is that what you're saying?
Irreversibly, correct.
Yeah. Okay. Is there any other ways people approach getting their teeth straight?
Yes, there's other ways. Of course, the traditional braces of putting the brackets and wires on there, where people commit, you know, 18, 24 months of being in braces, and that's a good way to grab hold of the tooth and move it to where you want it, straighten it up, and you're not destroying enamel. And also another way people move teeth is, I'm sure you've heard of Invisalign or the Clear Smiles, things of that nature. And these systems are out there. They do work in some situations. Quite often, though, when you're using those systems, you're looking for very minimal movement of the teeth, just a little bit of tipping, a little bit of turning, a little bit of crowding. But if your condition that you're starting with is challenging, then you may be moving back that 18 to 24 months to 36, a little bit further, and you're not even guaranteed that when it's all done, it's going to be exactly where you want it, how you want it to function.
So let's go back first to the traditional. I have two questions. The first one has to do with the traditional braces. Now, you were saying you would have to wear these wires and brackets and stuff like that for 24 months. Now, I've not worn braces, so I don't know. But when I've seen people who kind of have worn braces, and when they eat, it looks like stuff gets caught around their braces and stuff. Am I imagining that, or is that a problem or an issue? Can that cause a problem, or
yes.
Other than just having green beans stuck on your teeth and kind of looking weird? But is there any long-term problems with that?
Yes, there is, and we always try to hammer it into our patients and let them know that when you increase the surfaces, like having these brackets and wires around the teeth, those are more and more food traps that are on the teeth. So yes, you can get food stuck around them, underneath them, and the longer that teeth are in braces, the longer they have those brackets and wires on there, the longer you may have food trapped in places that you can't quite get to with the toothbrush. You can't floss very well. So you can see cavities around these brackets and around these wires. So I have had it before to where we have had someone in braces, and by the time we took them off, we're having to do a lot of fillings around them because they
Ooh,
were
that doesn't
for
sound
so
good.
long.
Yeah,
No, doesn't sound good.
no, that doesn't sound good to go. Okay, so now tell me a little bit about this Invisalign. Now, I think I understand it, but it was something I saw on a magazine or something. It looked like they had kind of like a tray or something that you had to stick on your teeth.
Yes, I kind of relate it to like a football mouthpiece, except it's not flimsy and it's rigid, and it snaps over your teeth, and it basically uses kind of a nudging, a gentle pressure to push teeth over here, turn them over here, and they are not. The Invisalign system is not actually attached to the teeth. So the movement you get is the movement you get.
Okay.
Hard to specifically direct the forces exactly where you want them for the movement exactly you want to see.
So do you eat with these in?
No, you don't eat with them in.
Okay, so you
take them out.
So it'd be like the reverse of my grandma. My grandma used to put her teeth in to eat. You take these things out. Take these out to eat. Then, right?
Yes, sir.
That could be interesting. And so you could lose them then, I guess, if you sat on them or put them on the plate and had the waiter take them away.
That's correct. People lose them between their car seats or close them in the car door. Things of that nature. But the other clinical thing that we don't want to see is every time you take that out, well, now your orthodontic system has been turned off. They only work when they're in. So we like to tell our patients, if you're going to do something like that, you need to have them in about 23 hours a day.
Wow.
And take them out just to eat, just to brush your teeth, things of that nature, but we want you to wear them as much as possible because as soon as you move the teeth, they come right back.
Okay.
If you take them off.
Okay, so I think I at least I understand. I hope our listeners understand what the traditional options were. But when I read your paper, I noticed you offered there was a new approach to straightening teeth, and it sounded exciting to me. Do you mind? Let's go off into that now. Let's talk about this new revolutionary option of straightening teeth, other than these three we talked about.
Sure. There has been some advances in orthodontic treatment, and the system that you're referring to that we offer at our office is called fast braces. And I had the pleasure and the benefit of having some postdoctoral training with the founder and the inventor of this system. And the nice thing about it is that it moves teeth differently than the traditional braces and the Invisalign. And you're not destroying enamel because you're not doing cosmetic crowns or something to that effect. It's very nice because, yes, it is a bracket and wire system. However, we see significantly reduced times that patients are in braces or that are in the fast braces.
Okay.
Reason being is, like I said, we move the teeth differently. Okay, so how are we going to move teeth differently? How are we going to move them faster? Well, when you have the traditional braces where you put a bracket on a tooth and put the wire through it, and you basically start forcing a tooth through gum and bone to the place that you want it, the body doesn't like that. And that's typically why traditional braces hurt and are uncomfortable, because the body has to deal with that, and then effectively, once everything has been sore and you've had the inflammation, it calms down and it says, okay, now I'm all right with that tooth being here, until you change to the next wire where there's more force and you move the tooth again. With the fast braces technology, we move teeth differently in the fact that the wire is the same wire from beginning to end. So you're not changing wires, you're not increasing force as you go. What you start with is what you end with. Okay, so there's the one moment of the body getting used to the forces. Next, the bracket is different. If you look at someone in braces, typically they have like 4 little attachments per bracket. Well, with the fast braces using a different shaped bracket, it puts less pressure on the wire and consequently the tooth. So just by a concept of physics and mechanical engineering, the forces that are applied per tooth is about 1 to 100 compared to regular braces. So instead of you shoving a tooth and the body going into shock, the body actually thinks that the tooth is being asked to just simply grow to a different spot.
Okay.
So the body doesn't go into shock thinking that the tooth is actually being pulled out, because you can imagine the discomfort of getting a tooth pulled.
Yeah.
As opposed to when you were a kid and your teeth just grew into place.
Mm-hmm.
I mean, it had a little bit of discomfort because, it's coming up through the gums as a little kid, but it didn't feel like you were having your teeth pulled when your baby teeth grew in and your adult teeth grew in.
Right.
So that is what I love about the fast braces technology, is that there's so much less pain and discomfort. And since the body thinks the tooth is just growing to a new area instead of being forced or extracted even, the body allows it to happen much faster. So we see braces time, or the entire time that a patient is in braces, can be reduced from anywhere to about a year to as short as, say, 3 months.
Wow, 3 months. Okay. So it sounds like, okay, I was going to ask you a couple of questions that you covered a lot of them, but are there any disadvantages to this fast braces technique?
Can't really see any. Sometimes people don't like the idea of being in wires and braces, which is the case with fast braces. It's brackets and wires. However, as compared to traditional braces, you cut your time in half or less.
Mm-hmm. Okay.
So it's nice that they're in something to that effect.
Okay. So is this procedure, because it's new technology and all that kind of stuff, I understand sometimes, when new technology comes out, this, it's always like, I remember the first computers were personal computers were $25,000. So, is this being a new technology? Is this extremely expensive?
Well, at our office, we have decided to not pass that increase onto the patients. I imagine there may be some practitioners out there that could. We don't. In our office, it's value neutral. We do offer the traditional braces because not everybody's a candidate for fast braces. So we like it to be, hey, if you're not a good candidate for fast braces, you shouldn't be financially penalized for that. So we make it a value neutral decision. Our fast braces are the same as our traditional braces, which, if you want to kind of put it in real world terms, it's about 2 years worth of your cell phone bill or your cable TV bill. Okay,
so if I'm kind of running this through my mind real quick here, and I'm thinking, okay, would I have to come up with all that at one time? Are there any options there?
Well, it's great, Kelly, to come up with it all at one time, but we understand that may not be an option for everybody. So we do have some really nice plans that we can work out with people because we want to see them have the treatment they want and not solely be held back by, financial obligations. So, our staff is really creative with the way that we can come up with plans that work for our patients.
Excellent. Okay, so this sounds so terrific, Dr. Jones, and I guess I'm confused because I've not heard a lot of dentists that do this fast braces deal. Why don't all dentists offer this? It sounds like such a great service.
Well, that's a good question. I'm surprised that I haven't seen more dentists doing it, or at least having it in their in their tool bag of something to use. But some people don't like change, and they've done things a certain way for a long time, and it's worked well for them. So they don't want to maybe venture out of their comfort zone. Sometimes it's the relationship the dentist has with their orthodontist as far as referrals go, and so they don't want to take away those patients from their friend the orthodontist.
He might not send them a turkey for Christmas.
That's right. They want their Thanksgiving turkey. And but I mean, to each their own. I think it's great that dentistry and orthodontics is kind of going in this direction. Years and years ago, we needed the specialists to be, extra trained because maybe we were limited by technology. But now the technology is starting to catch up with the field, and it's allowing more and more of your dentists to do those specialized procedures just because they have better equipment in their hand. Also, information with the internet is so much more available and easy to access. Plus, the way that we dental professionals can interact with each other as far as, hey, I've got this problem. Have you seen it? Yes, I have. This is what I did. Okay, great. You've had good experience with that? Yes. So the interaction, the sharing of information, and the technology really makes it more available for other dentists to do things like fast braces. But it's to each their own. Yeah.
Okay. Well, that's very understanding. And Dr. Jones, this has been a great time. I'm afraid I'm looking at the clock here, and we're running a little bit out of it here. So I promised our listeners that you would let them know how to get more information about the straight talk and crooked teeth, or any other dental topic that they may be interested in, but also, more importantly, how they could take advantage of this free gift. Can you tell us what they need to do?
Sure. If you call into our practice and tell Lori you want the webtalkradio.net complimentary fast braces evaluation, you'll receive a free exam, x-rays, and consultation by me, and I can let you know if you're a good candidate for fast braces or if there's a better option for you. Okay.
Well, that is awesome, Dr. Jones, but we'll need to know how the best way for them to get a hold of you. What's the best way to get in contact with your office?
The best way to contact us is to call 405-494-1627 and ask for Lori.
Okay, well, that, I tell you what, I just want to thank you. I know you're very busy. You've got a big practice. You've got a lot of patients. And I just want to thank you for your time, Dr. Jones. And I want to thank the listeners for listening to DDS, Disclosing Dental Secrets Expose. And I want them to stay tuned for our next WebTalkRadio.net interview, which once again promises to go boldly where no one has gone before.